This presentation is going to be investigating the psychosocial factors in older people at risk of falling. To begin, Medway is defined as an urban area by Medway Council. It consists of small towns and villages, but the main 5 towns include Strood, Rochester, Chatham and Gillingham. The Office of National Statistics estimated that in 2016, Medway's population consisted of 278,542 residents. This number is going to increase, and by 2028 is predicted to stagger by an extra 20,400 residents. Medway consists of 55 GP surgeries and one main hospital, which is located in Gillingham and responsible for providing services for over 500,000 people per year. This is relevant to paramedic practice, as approximately 110,000 of which are emergency attendances. Globally, it is documented that life expectancy is at its highest ever level. There are now more than 500,000 people living in their 90s, which is 2.5 times more than the number in 1985, Office of National Statistics, consequently meaning more people are at risk of falls. As said earlier, it is estimated that by 2028, Medway's population is going to increase by 10%, but specifically, 81% of this predicted growth population is estimated to be accountable by the older generation. This means that by 2028, 47% of Medway's total population will be old people. Talking a little bit more about falls themselves, the American Geriatric Society defined falls as an event whereby an individual comes to rest on the ground or another lower level with or without the loss of consciousness. In Medway, this chart shows specific number of fall-related admissions into hospital in 2012. The chart highlights that the fall rate for males over 85 doubled from the 80 to 84 age category, and females more similarly increased, but by more than double. This shows the higher the age, the increased likelihood of falling. With the raise in life expectancy in Medway, this suggests the demand for fall-related ambulance calls is going to increase. This can be supported by a Better Medway UK, whom recognise that Medway's A&E has seen a steady increase in the amount of older people falling over the past 4 years. So, because both ambulance and A&E data recognise that falls are a main reason in people accessing emergency services, I decided to look at why this may be. I investigated the psychosocial risk factors that could increase the likelihood of falling. Firstly, I found that hoarding could cause an increase in chances of older people falling. This may be due to the extra things laying around their house and thus something to trip on. I then looked at depression and found many studies which specifically found a high correlation between the two, suggesting that depression may cause an increase in falls due to things such as possible lack of exercise and poorer balance. I also found there was a link between taking antidepressants and falling. I then found studies to suggest elderly people that live alone are more at risk of falling in comparison to those who live with others. The fear of falling was also found to increase the chance of it happening, according to a study by Abda Quaita et al. 2013. Elderly people that suffered from a fear of falling were 3 times more likely to do so in comparison to those who were not fearful. Lastly, I looked at Medway Clinical Commissioning Group 2016, who found that within Medway, a lack of socio-economic capital is linked to decline in health and therefore a shorter life expectancy. Linking to falls, an elderly person that has a low income, for example, may be more at risk due to things such as poor housing, causing things to trip over, for example, frayed carpets. Briefly linking to an example from placement, I got a call to an elderly woman who had a mechanical fault in her home and sustained no injury. The patient had many risk factors that were just mentioned, such as experiencing an ongoing fear of falling due to a previous fall the same month. The patient also lived alone and had a history of depression. The patient's home lastly contained many mechanical fall risks, such as stairs, uneven flooring, and rugs. The patient was not taken to A&E due to the fact no injuries were sustained, but paramedics referred patient back to the GP and falls referral team. Medway Council 2014 recognises that falls not only cause harm physically, but can also cause psychological harm. Falls can cause patients to become nervous to move around and consequently mean they may become immobile. Linking back to practice placement, this has been experienced when elderly individuals stop, going to the toilet, and over time become incontinent because they are unwilling to risk falling. I then looked at current interventions that stand in Medway for older patients at risk of falling, and one widely recognised is Age UK, a service that provides support and advice to elderly people. It tackles a variety of issues from loneliness to falls and has contact numbers and area-specific services that can help elderly people gain confidence again. This was recommended to the patient from the example that I shared earlier. A clinical care pathway includes the GP and the community falls service. An elderly person's GP may have routine appointments whereby they ask the patient about how often they fall and carry out vital sign tests to ensure the falls are not medical related, e.g. syncope or caused by hypoglycemia. A patient can also be referred to the Falls Prevention Service, which supports and treats the reversible causes of falls. This may include things such as rehabilitation and working with other healthcare professionals. The patient I witnessed in practice was referred to the Falls Prevention team and was awaiting an assessment. NICE guidelines are currently in place to prevent falls in the older population. The NICE guidelines provide a flow chart of different situations whereby explaining ambulance crews must assess, educate themselves, and gain information, decide possible interventions, and then discuss the appropriate solutions with the patient. JRCalc also provides guidelines that suggest that ambulance crews must recognise why the patient has fallen, rule out any possible medical reasons such as syncope, then carry out a detailed physical assessment, exclude injury, and then decide whether the patient can be managed at home. Every older person that has fallen and been managed at home must be offered referral pathways to prevent this from happening again.